Hi, I'm Dave Wurzel, and you're watching PHTV4, and we are at Northwestern Medicine Palos Hospital. They're opening up December 14th, the official opening date for the, I'm going to make sure I get the word right here, Bluhm Cardiovascular Institute Advanced Outpatient Clinic, so brand new facility. And we have just a minute. We're very fortunate to talk to President Jeff Good, President of Northwestern Medicine Palos Hospital. Thank you very much for taking the time. Can you tell us what this opening this facility means, for Northwestern, but also the community here?
Yeah, with Northwestern Medicine here in the Palos area, it's been almost 2 years since we officially became, part of this community. And the thought process about Northwestern Medicine expanding throughout the Chicagoland area is to bring that advanced level of care, whether it's cardiology, oncology, neurosciences, close to where people live and work. So having this new clinic very accessible to patients that come to the hospital to come see a cardiologist, have outpatient testing done, it's just a great addition for this community.
I was going to say, and you mentioned some of the other things going on. There are a lot of, things, it seems like within the last year or two, a lot of things happening at Palos Hospital, including the Orland campus, but in our area. Do you want to talk a little bit about, how are those things developing and anything coming up that we should be aware of?
Sure. The thought process around advancing, the quality and level of care provided in a community, oftentimes surrounds cardiovascular care, oncology, and neurosciences, as I mentioned before. And if you can be great in those three areas, it just elevates the level of quality and care that is brought to that community. So there's been a number of projects that have been completed thus far. So there's a brand new cancer center on the Orland Park campus that opened back in August. We have 3 neurosurgeons full-time on staff here at Palos Hospital that we haven't had neurosurgery on staff here in decades. So we're just advancing the level and quality of care and the type of care that's available to this community.
Thank you. As a member of the community, thank you. It's exciting that these types of services, are now available in our area. And obviously, we wish you the best. This is an exciting new facility. Thank you for taking time with us this morning. Good luck. I'm looking forward to, all that Palos Hospital and Northwestern Medicine can provide. Thank you.
Thank you.
Hi, I'm Dave Wurzel, and you're watching Medical Update on PHTV4. And this is an exciting day here. We're with Dr. Matharison from Northwestern Medicine. And the Palos Hospital campus of Northwestern Medicine is opening up a new space, a new clinic space. We're at the Bluhm Cardiovascular Institute, and they're opening an advanced outpatient clinic. And it's exciting. And we're going to get a quick tour. And maybe, Dr. Matharison, if you can tell us a little first about, right now we're standing in, I guess, a receiving area, right? And then can you kind of walk us through a person goes from here to there, what that looks like?
Yeah, absolutely. And thank you for coming down and visiting with us. So we're very excited for the opening of this clinic, and it's really, I think, a tangible marker of Northwestern Medicine's commitment to the southwest side of Chicago and Palos Heights and the community. So we're in the lobby, and this is really where patients would be greeted. We would go back into the clinic area where we'll spend a little bit of time. And that's where patients can really get the most advanced cardiovascular care connected to the downtown hub at Northwestern Memorial Hospital. And the idea is really for us to be out here in the community where patients live and work to get that advanced level of care. And only for the most advanced cardiovascular treatments would need to visit the downtown campus. That's the general idea of what we're about.
So a patient can come in here and they'll move, into that space there. They can get diagnosis, treatment, or depending what type of care they need, and it can level up. And I mean, that's the nice thing about the connection to Northwestern, right?
Yeah, exactly. We operate as a system, and I know all of my colleagues across the system, and the idea is that we want to deliver as much care as we can in the community where patients live and where it's easy for them to get care. But sometimes there's really advanced cardiovascular care. For example, if someone needed a heart transplant, that would be something that we would be able to do a lot of the testing for and the aftercare for at Palos Hospital in the clinic, a clinic like this. But patients could travel to the downtown campus to get that really top advanced level of care.
Yeah, from a patient standpoint, I think about how nervous they can be in that situation or their anxieties, and to know that they're getting great care here and they have access to great care downtown too if they need it. Thank you. How about let's take a look at one of those rooms you were talking about, one of the spaces that's available to us. Thank you. Thank you for taking a few minutes this morning. They're opening up a brand new Cardiovascular Institute advanced outpatient clinic here, right? And it's exciting. And before you talk about the clinic a little bit, can you give us your background first?
Yeah, absolutely. My name's Cardiovascular Matharson. I'm a cardiologist. I practice out of Northwestern Memorial Hospital, and in the last year, I've been privileged to be named director of Bluhm Cardiovascular Institute down here in the southwest side at Northwestern Palos Hospital.
Congratulations. Welcome to Palos Heights. Glad to have you here. Especially now, this is an exciting new facility. We got a little bit of a walking tour, saw the layout, the arrangement. I get it's a very, very good design. I understand the benefits from it. We're in a room right now. Maybe you can talk about what room are we in, how would this room be used?
Yeah, so this is one of our state-of-the-art clinic rooms that we're calling the Clinic of the Future. And really the idea of the Clinic of the Future is to enhance that patient experience so that when patients come in to see their doctor or their nurse practitioner or their physician assistant, they're really getting the experience where they're talking to their provider and the technology is fading into the background. I mean, we've all had the experience where you go into a physician's appointment and your doctor's kind of stuck on the computer trying to deal with things, and we want that technology to get leveled up so that it actually fades away, and we'll show you a little bit of that.
Let's say that's kind of exciting. You're right. I've had that experience, and I have a great doctor. Right? He's a great guy. I love seeing him for the right reasons, not the wrong reasons. But yeah, I understand the technical component to it when they're working on their laptop and talking at the same time. And maybe and we can talk about the screen a little bit. But even before that, how about can you talk about in general, like having this facility in the southwest suburbs? What does that provide for the community? What does that mean?
Yeah, so Northwestern Medicine is always dedicated to providing care where patients live and work. And for us, this is a really tangible, meaningful part of that commitment. We're here in the southwest side to serve the community. That's what we're about. And the goal is really to help work with physicians and cardiologists and patients who are already in the community and help deliver that high quality care, create a platform where patients can get the best care that can.
So there's a lot in there I'd like to unpack just a little bit because it is really important. Bring the service to the community instead of having to make the trip, for example, downtown.
Yeah.
We have that level of care here now. How does this, so you as a doctor working here or for the staff members here, how does it make their job better or them able to do their job better for their patients?
Yeah, well, first of all, it's a great community. You know, I've practiced downtown for a long time. I grew up in Philadelphia. Palos Heights in the area actually reminds me a lot of my hometown, Springfield, Pennsylvania. So it's wonderful because we are really close to all the testing a patient needs. So a simple thing is right down the hallway is where a patient would get a stress test, where they get an echocardiogram. Everything is in real close proximity. So that means for patients, their doctors are always around. They're able to come back and forth. If something happens on a test, the doctor is right there. So I think there are a lot of benefits for having a brand new facility right in the heart of the hospital.
So the organizational is a huge piece of it. So it's compared to like a person navigating a hospital or down that wing or that, where they're going to move through this facility and have that type of immediate contact, right? Okay. Can you talk about the monitor then behind us and how that fits into what a patient would experience here?
Yeah, so our goal with the Clinic of the Future is really to change how the patient experience happens in the clinic room. A big part of that is having just a lot of screen real estate to show patients their echocardiograms, their angiograms, various testing. But another part of that, and things that we'll be bringing in, is having artificial intelligence with the patient's consent come into the patient's room to really take away a lot of that documentation burden from the provider so that patients can really have a nice conversation face-to-face like we're having and not have that computer get in the way of that conversation. So I'd be happy to show you a little bit about what it looks like.
Yeah, can you tell, so what is the image we're looking at, if that makes sense?
Yeah, so what we're looking at is an echocardiogram. It's an ultrasound of the heart that helps us diagnose various heart conditions. And what we're looking at here is a narrowed aortic valve. And aortic valves are valves that can actually be opened up instead of an open heart procedure, a lot of times patients can actually get that procedure done through a catheter-based procedure and go home the next day.
So it sounds, so a person could be in here with their doctor and they could explain visually exactly what they're looking at and how that affects their care, what type of attention they need.
Exactly right. And the other thing that we'll be doing is being able to patch in family members and other loved ones who are remote through, say, a Teams meeting so that they could be a part of the conversation. So it's really about making it a great experience for patients.
Yeah, that is incredible. It feels very comprehensive. It's covering so many areas of it. Anything else you want to mention about the care here that's unique or, let's say cutting edge? We're being at the front of things. And then also, I do want to ask a little bit about the future of the clinic. Are there things down the road that we'll see soon?
Yeah, so a lot of things have happened over the last year, building on the already great care that Palos Hospital has been providing the community. We've started doing cardiac MRIs. We've started implanting PA pressure monitoring devices that help monitor patients with heart failure. We've started expanding our structural interventional program such that we can now do more TAVR procedures. These are those valve procedures that we can do through a catheter-based procedure. And a big part of all of this is really bringing specialists to the community so that patients can have their diagnosis, their testing done in the community, and really the most advanced levels of care can be done at Northwestern Memorial Hospital. If a patient needs a heart transplant, a ventricular assist device, or needs the latest cutting-edge clinical trials, the idea is, well, all that decision-making and thinking can be done in the community, and you really only have to go downtown for that one procedure.
Right. I was to say that is such a huge step because I'm old enough to remember where, yes, you had to make the trip to that hospital because that was the only place you get care like that. Now, it sounds like so many things can get taken care of here first. If you need the level of care, then you make that trip to the other hospital, right?
Yeah, that's exactly right. That's exactly the idea. Hey, let's figure it out in your community, and if you need something at that really top level of care, then you can make that trip downtown.
Okay. Doctor, thank you very much. It's exciting, it's fascinating. The type of care that is available in this area that you're able to provide, Northwestern Medicine is able to provide, is really exciting. So thank you for taking time to talk with us this morning, and good luck.
Thank you so much, and I really appreciate the opportunity to talk about this new clinic that we're very excited about.
I would think, it's exciting. All right. I'm Dave Wurzel, and you've been watching PHTV4 Medical Update. All right, we're here with Dr. Johnson with Northwestern Medicine. We're very fortunate. He's going to be able to give us a little bit of background on the connection between the Palos campus and Northwestern at large. And first, Dr. Johnson, if you could give us a little bit of your background. Congratulations, I know you just got a brand new appointment a couple months ago.
So thanks very much. It's great to be here. So my name's Doug Johnston. I just started with Northwestern about 2.5 months ago. So I was at the Cleveland Clinic for 17 years. And I've just taken over as the Chief of Cardiac Surgery for Northwestern Medicine, and I'm the Surgical Director of the Bluhm Cardiovascular Institute. And you might ask, well, what does that mean? Well, this is a pretty unique place in that we look at cardiac surgery as a team of experts that operates across the health system. So in my role, I'm in charge of all of the operations that we do, whether it's Palos or Northwestern Memorial, CDH, so all of our sites around the Chicago area. And as you may know, we restarted cardiac surgery here at Palos just in October. My friend and colleague, Dr. Andre Chirila, and I did the first operation here in mid-October under Northwestern leadership. So the program is growing very quickly, and we anticipate Palos being a very important site for cardiac surgery, but also as a way to diagnose and treat patients who are at earlier stages of disease who may need a high level of expertise somewhere within the system.
You know, that's a really important point that you brought up when you mentioned the other hospital campuses. Well, first of all, congratulations and welcome to Chicagoland area.
It's great to be here.
Great to have you here. So the Northwestern Medicine Palos Hospital campus, we've got this brand new institute, or brand new clinic here, but it is closely linked with these other campuses and with downtown. Can you talk about that a little bit and how that benefits doctors and patients?
So our philosophy really is that you should be able to get access to the same level of expertise No matter what the disease process, how rare your condition is, even if it's something that a few people in the country deal with, no matter who you are and where you are. So if you live in this area and the best place for you to get your care is at Palos, we have this beautiful new clinic. You'll be able to get all of your workup done here, your diagnosis. You can see excellent cardiologists like Dr. Mutharasan that you met earlier, and all of that work can be done here. If it ends up being a procedure that is very high level, that's something that we might not want to do at Palos now, then we might schedule you for an intervention downtown. But increasingly, we'll be leveraging the great clinical campus we have here and the strength of the teams to expand the offerings of what we can do here at Palos. So as we grow, we'll be adding more complex procedures, more high-end procedures, more minimally invasive surgery on this campus. And really the principle is to bring the care where it makes the most sense for the patient.
Yeah, that's exciting for the southwest suburbs and the community at large to have access to this level of care is truly a fortunate thing for the community. We're excited that this is happening here, and it looks like what the future looks like for this type of care. Thank you very much. I appreciate this. Welcome again to Chicagoland area, and we're so excited about this clinic opening here. Thank you, Doctor.
Thank you very much. Great to be here.
I'm Dave Wurzel, and you've been watching PHTV4. This is Medical Update, and we have been at the new advanced outpatient clinic opening up at the Northwestern Palos Hospital campus. Thank you for watching.